Welcome to Charlie's Edition. In tonight's show, let me rephrase that. Welcome to Charlie's Edition, the Joy of Gay Sex series tonight. I am your host, Charlie, aka Miss Charlize, and as I told you guys on last week's show, tonight we're basically going to be talking about STDs, the different kinds of STDs, what these STDs do to your body, if there's cures for them, so what and so forth. So that's what we're going to talk about tonight because it's a very interesting topic because there's only a few STDs out there that people hear about, but what about the STDs that people don't hear about? So I'm going to read about them tonight out of the flawless book, Joy of Gay Sex. So let's begin, shall we? Sex is the spice that makes life exciting. That excitement, however, may come at a price, in the form of sexually transmitted disease. Whether you're young and still going through your slut phase, or tricking outside a long-term relationship, you may have to pay the piper for all that fun. It would be hard to find a sexually active gay man who's never had to see his physician for an STD, either something pesky, such as crabs, or more serious, such as hepatitis. As a gay man, it is essential that you have a basic knowledge of STDs so that you can recognize the symptoms in you and in your sexual partners. If you discover symptoms that may be STD related, it is your responsibility to insist on being given the correct diagnostic tests and treatment by your physician. But you have another responsibility, to notify your sex partners about your infection. Not doing so is a sign of childishness and hostility. At one time, we used to talk about venereal diseases, those that directly affected the genitals, such as gonorrhea and syphilis. But we have a more sophisticated understanding of disease today, and doctors generally divide them into bacterial, viral, and parasitical, what we call larger critters. We'll follow that classification below. Since AIDS is covered in a different section, we're not going to discuss it here. Of course, I will read, what AIDS and HIV is and the differences and all that stuff. But I just want to read you guys some of the different STDs that are definitely out there. Bacterial STDs. Bacteria are everywhere in the world around us and are believed to live in the most hostile environments. Beneath the sea at the mid-Atlantic ridge, where hot lava geysers out of the earth at boiling temperatures, under Antarctic ice, within dust molecules in the upper atmosphere, and even inside rock miles deep beneath the earth. Some biologists believe that the bacteria constitute the largest and oldest body of life on Earth. It is impossible to avoid bacteria in daily life, and some bacteria are needed by the body to function. In your digestive tract, for example, where they help to digest food. Bacteria reproduce by themselves, and only a relatively few, given their enormous number, are harmful to humans. Your blood generally produces white blood cells to fight off hostile bacterial invaders. Some potent ones, however, can gang up and get the upper hand. That's when you get sick. Among the most commonly sexually transmitted bacteria are 1. Gonorrhea, commonly called the clap, after Mother Clap, who ran a bodily house for homosexual men in Holborn, a section of London. 30 to 40 men a night were entertained there until one day in 1726 she was charged with keeping a sodomitical house. The poor lady was fined, pillared, and sentenced to 2 years of hard labor. We don't know if she survived. Now let me tell you guys what basically gonorrhea is. Clap is a major health problem in gay men. About 15% of men who get diarrhea in the penis, get gonorrhea in the penis, do not develop symptoms, and even those who may not see them for 2 weeks. That makes detection difficult. Carriers without symptoms can transmit the disease without knowing it. Therefore, men who practice unsafe sex should have a routine STD checkup every 6 months. Every 3 months if you're still being a slut, which means an anal, penile, and throat smear, and a urinalysis for CLAP, and a blood test for syphilis while you're at it. A blood test alone will not diagnose gonorrhea. Even if you have regular checkups, you can unwittingly infect an awful lot of people before you discover you have the CLAP. The bacteria prefer a warm, moist environment like your cock, rectum, and throat. You can get CLAP in the cock by getting a blowjob from someone whose mouth is infected, or you can get it in the mouth or throat by sucking someone with an infected dick. Symptoms normally appear between 24 hours and 5 days after exposure. The chief symptoms are a discharge of thick, creamy pus and burning during urination. The pus is produced when bacteria invade the cells that line the urethra. By milking down your cock, you can see the earliest signs of pus. You should also check your underwear. The dried pus will make the pouch of your underwear stiff. Some sexually active gay men never undress with the trick with the lights off. They quietly take down the trick's underwear in the light in a sexy way and check his dick for a discharge. If they find it, the trick goes packing. He shouldn't be having sex while he's infectious. This procedure needn't be clinical. Use your imagination. If, however, you delay treatment, the infection will spread up to the urethra and into your prostate, which will really fuck you up. You can develop the CLAP in the ass if someone with gonorrhea fucks you without a condom. Symptoms are usually slower to show up in the rectum. If they develop at all, and detection is certain only if your doctor looks at a smear under a microscope or cultures the bacteria in a laboratory. The symptoms you might notice are rectal fullness, feeling as if you have to cramp, pain, frequent farting, rectal bleeding, hemorrhoids, pus or blood in the stool, diarrhea, constipation, and sometimes an inability to piss. Urinary retention is brought about when bladder nerves are infected by gonorrhea. The symptoms don't necessarily mean you have gonorrhea. Only a test can determine this. But be forewarned, you may not have symptoms at all, or you can have CLAP in both your cock and your ass. But because you can feel the symptoms in your cock more clearly, you might not notice what's happening in your butt. If your doctor is heterosexual or unfamiliar with gay health problems, get over your shyness and tell him that you need to be regularly tested in the rectum. Don't be reticent about asking for an anal smear. Some straight physicians are embarrassed about asking. If your doctor refuses to do an anal smear, walk out. Don't pay the bill and get a new doctor. Now, this part that I'm about to read is actually talking about symptoms that might be in your throat. Gay men also contract gonorrhea in the throat. Symptoms are often absent, but when present are a sore throat, a cough, a respiratory congestion, and other cold-like disturbances. Sometimes the glands under the jaw swell. CLAP in the throat is less frequent than CLAP in the penis and anus, but then again it depends upon your sexual behavior, who or what you do and with whom. Gonorrhea should be treated immediately. If it is not treated, the acute symptoms will go away for about 6 months, but the disease may lead to arthritis, pericarditis, or pericarditis, which is inflammation of the sac around the heart, or emphysema. Medical authorities have also learned that men with CLAP are at an increased risk for getting infected and infecting others with HIV. Your physician, of course, must confirm all these suggestions. He alone can't prescribe treatment, though you should insist that he take a cure culture after treatment. That means testing you again for the disease to be certain that you are cured. Don't even think about telling your lover, should you infect him, that you picked up the CLAP, or any of the following STDs from kissing an old flame. sitting on a toilet seat at work, using a dirty towel at the gym, or drinking from a greasy, watery cup. This kind of bacteria needs a constant supply of carbon dioxide and dies seconds after exposure to air. In any event, your boyfriend won't believe your bullshit, and you'll be correctly accused of both tricking and lying. This will cost you at least 10 sessions of couple therapy, lectures about double betrayal, and a bill of particulars about the tawdry behavior going back to childhood. Pony up to your infidelity, take your punishment, and don't lie. So, ladies and gentlemen, that was some information about at least one of the STDs, gonorrhea. So, definitely, if you've experienced any of those symptoms, if you're very sexually active and you've experienced this or seen somebody else experience this, definitely go get checked. So, coming up on part 2 of Charlie's Edition, I'm going to talk to you guys about syphilis, hepatitis, herpes, crabs, parasites, and even scabies. So, stay tuned to part 2 of Charlie's Edition, Joy of a Gay Sex series. Holla.